Good morning, good afternoon, good evening to our distinguished colleagues and friends joining us from around the world. It's my great pleasure to welcome you to this important webinar on artificial intelligence in healthcare in resource-limited settings, local experience, challenges, and opportunities, jointly organized by People to People, Bahar Dar University, and the Anandach Group, with artists and RFP serving as strategic co-hosts. We are gathered at a defining moment. Artificial intelligence is no longer a concept of the future. It is actively reshaping how we educate healthcare professionals, deliver patient care, and conduct research. Whoever leads in AI will define the future, and we intend to lead together. AI is not just a technology. It is the platform that connects education, healthcare, finance, media, and global collaboration into one integrated ecosystem. It is a connective tissue that unites knowledge, innovation, and communication, transforming our shared vision into a measurable impact. In healthcare education, AI offers powerful tools for adaptive learning, simulation-based training, and expanded access to high-quality medical knowledge, helping to bridge gaps in faculty and infrastructure. In clinical care, AI has the potential to enhance diagnostic accuracy, optimize workflows, and extend services to underserved and remote population. In research, AI enables us to analyze large data sets, accelerate discovery, and generate locally relevant evidence that can inform policy and practice. However, as we embrace these opportunities, we must remain firmly grounded in strong ethical principles, ensuring patient privacy and data protection, addressing bias and fairness in algorithms, promoting equity in access to AI technologies, preserving human-centered care where technology supports but never replaces clinical judgment and compassion. As we always say, AI use algorithm and data, but we humans, we use our brain. So as P2P, we believe innovation must go hand in hand with responsibility. Our goal is not only to advance technology, but to ensure it is used ethically, equitably, and sustainably, particularly in resource-limited settings where the stakes are highest. Through partnership like this, including the vital roles of artists in communication and RFP in digital innovation and financing, we aim to build capacity, empower institutions, and positions Africa not just as a participant, but as a leader in the AI-driven transformation of healthcare and education. The future of healthcare will not be defined by technology alone, but by how wisely and responsibly we chose to use it. What will ultimately define our success is not how advanced our algorithm become, but how effectively we translate innovation into impact. For us, especially in resource-limited settings, the question is not whether AI works, but how to make it work where it is needed most. This requires moving beyond pilots and prototypes to real implementation, embedding AI into medical education, integrating it into clinical workflows, building a strong local data systems, investing in human capacity and creating sustainable financing and policy frameworks. Equally important, we must shift from being consumers of AI to becoming creators and co-developers, bringing our data, our realities, and our priorities to the global stage. If we get this right, AI will not widen the gap, it will help us leapfrog it. And above all, we must remember technology is powerful, but trust is everything. Without trust, no innovation will endure. Let us move forward with clarity, courage, and collaboration, turning promises into practice and vision into measurable impact. AI is not just shaping the future, it's connecting us to it, and together we will lead that future. Before I close, I would like to take a moment to recognize a key individual whose vision helped initiate this important journey. AI within P2P was truly Professor Demes's brainchild, and we deeply appreciate his vision and leadership in setting this direction. Our first AI conference in October 2023 laid the foundation for what has now become a growing and impactful platform. He was instrumental in setting it together and moderating the session. Professor Demese, if you are able to join us, even briefly, we would be honored to publicly acknowledge your pioneering role and contributions.
Thank you, Dr. Naugao, for the nice acknowledgement. Actually, all the credit should go to you and the P2P leadership for continuing this important series of workshops. I truly appreciate your recognition. Unfortunately, I cannot join you or turn the camera on as I am traveling. And I wish you a successful workshop. Thank you so much.
Thank you, Professor Demese. And well, we know like you have a very hectic program and traveling. So safe journey, and thank you. So now it's my distinct pleasure to introduce our opening speaker, Dr. Bakalu Wubshet-Zaude, who serves as the Chief Executive Director and Vice President of the College of Medicine and Health Science at Barda University. Dr. Bakalu is a highly accomplished physician and academic leader. He is an assistant professor of orthopedic surgery and a consultant pediatric orthopedic surgeon certified by the College of Surgeons of East, Central, and South Africa. Beyond his clinical excellence, he is an experienced health system leader known for his strong communication skills, collaborative spirit, and ability to lead multidisciplinary teams with vision and purpose. Dr. Bakalu has been instrumental in advancing medical education, clinical services, and institutional development at Barda University. Please join me in welcoming Dr. Bakalu Wubshet-Zaude to deliver the opening remarks.
Thank you. Thank you so much, Professor Nogo, for a generous introduction. I think because of a poor connectivity, I will keep, and for the clarity of my audio, I will proceed making of my video. I thank you so much, people to people, Adak, and it's a great pleasure and honor to host this consecutive workshop on AI in healthcare and in higher education. We are so very much privileged as the College of Medicine and Health Sciences and Barda University at large. So, good evening, good morning, wherever you are joining from, dear our virtual participants, students, faculties, university leaders, health system leaders, both in Ethiopia and abroad. It is an honor and a privilege to welcome you and to give you this opening remark in this important virtual workshop on artificial intelligence in healthcare, especially the local experience, the challenge, the opportunities in low resource settings like ours. So this timely initiative and a collaborative workshop organized by P2P, ANADAC, and Barda University College of Medicine and Health Science is at a pivotal moment where global health generally is challenged with lots of burdens, both from communicable, non-communicable disease, trauma and emergency, and the mental health. Especially artificial intelligence is no longer a distant concept confined to advanced settings and advanced health systems. It is also an opportunity and a challenge in low resource settings like ours. So, as a country, we It can extend the reach of scarce specialties without border, optimize the resource allocation. It can strengthen also disease surveillance, particularly for conditions that disproportionately affect our communities, such as preventable infectious disease, maternal and child health conditions, and emerging public health issues. At the same time, as you know, we must approach also AI with critical and responsible mindset. Issues of data quality, ethical governance, equity, privacy, contextual relevance are not optional considerations. They are central to success. If AI systems are trained on data that do not reflect our population, or if they are deployed without adequate oversight, they risk reinforcing existing disparities rather than solving those problems. So that makes really, the AI use in low resource settings, the practical points, the challenge and the opportunities are a very good point of discussion as a thematic area settled for today. So we are not also merely discussing technology, we are engaging in broader conversation about health system transformation, capacity building, strategic leadership. We are exploring, in teaching universities, in research universities in Ethiopian context, how health institutions can responsibly adopt digital tools, how policymakers can create enabling environments that balance innovation and regulation. So this is a very important turning point to lay a foundation from the very beginning before harm is emerging, and how to ethically use and regulate artificial intelligence in our low resource settings so that we can address the mentioned disparities. The collaboration aspect is also very important. We cannot really, play this sector single-handedly. So collaboration within the policymakers, universities, health system leaders, both in our country and internationally, is also very important. This should be a collaborative project. So, dear participants, it's a great honor again to keep the conversation on AI use in higher education, healthcare, specifically for today for low resource settings like ours, to discuss on some practical points and further on opportunities and challenges. I look forward and at Bardha University College of Medicine and Health Science, we're really looking forward to further strengthen. I thank you so much, and Professor Nogo and all the team. Thank you.
Thank you, Dr. Bakalu, for very succinct and very powerful pointers. And I have no doubt Bardha University is going to be a driving force intercontinentally, and it would be also known as one of the few universities is going to invest in AI. There are so many geographical advantages. In fact, by being very close to the grid, the hydroelectric power, as AI requires magnificent, massive energy. So it's naturally, geographically, well situated to the current situation. And Bardha University has leaders like you who want to put the university in front of the curve instead of behind the curve. So thank you so much.